So, what are we talking about tonight? So, we are talking tonight about sterilization, and sterilization is available to people that have all of the different parts. So, we can talk about sterilization for folks that have penises, scrotums, and testicles, and then we can also talk about sterilization for those that have uteruses, ovaries, and tubes. And so, we're going to talk about both because the procedures are, as you're going to learn, they're both highly effective and permanent, but they're different. And we're going to talk about what those differences are and why some folks may want to choose one versus the other. But what sterilization is, just by definition, is a permanent form of contraception. So if you undergo a sterilization procedure, and we do, very thorough counseling, and people come to these things with lots of thought put into it. But what it means is that if you yourself have a uterus, that you would not be able to be pregnant or have another pregnancy or any pregnancy for the rest of your life, versus if you have sperm, that you would not be capable of causing a pregnancy for the rest of your life. And these are safe, highly effective, and again, permanent procedures. Two things that we do. So I think everybody knows we do vasectomies for those that have penises, vas deferens, testicles, scrotums, and then we do salpingectomies, and we'll talk about those for folks without these anatomical structures. So what a vasectomy is a procedure for people with testicles. It is an outpatient procedure, meaning that you come into the office, it's done in an office, it's not done in a hospital or an operating room in most situations. It is done with local anesthetic, so that's numbing medicine, same type of medicine that you might get in your teeth when you go to the dentist or if you've had stitches. And it takes somewhere between about 20 to 30 minutes to have it done. And again, because it's done under local anesthetic, you don't have to have a driver. You can drive yourself to your procedure. You can drive yourself home. Some people bring somebody with them and have a driver, and that's great as well. But you don't have to. You can drive yourself. And the way it works is, if you look at this diagram, sperm are produced in the testicle. And then what typically happens is they travel up those vas deferens, which is that tube. They're very long, goes to the prostate, and then adds the sperm to the ejaculate, so making you be able to cause a pregnancy with the sperm. And so what we do in vasectomies, and we're going to talk about this a little bit more and show you some more images, is we divide that vas deferens. So what happens is we prevent sperm from entering the ejaculate. So you still make sperm. Everybody's going to make sperm over the rest of their lifetime. But the ejaculate itself does not have sperm. So the ejaculate is the same, the volume is the same, it looks the same, all of those things. It just doesn't have sperm in it. And it is a highly effective procedure, greater than 99% effective once you've done the procedure and done the follow-up testing. And we offer vasectomies for folks at age 18 and up here in St. Louis, as well as in Illinois and other parts of Missouri. So this is just a little bit more of a diagram of how we do the procedure. So it's actually done with a very tiny incision. And in fact, I don't even call it an incision when I do these procedures. I call it a puncture site. So at the end, you don't have stitches, staples, glue. In fact, not even a Band-Aid. We don't put anything on the outside. So a very tiny puncture site is made in the center of the scrotum. In this picture, it looks like it's on the side, but it's actually in the front of the scrotum. And what we do is we divide the vas deferens after numbing, first on one side and then on the other. But once that is done, like I said, you still make sperm. So sperm gets made and is just released into the scrotum where it's recycled. So it's a very, very small volume. And then we seal off the other end of the vas deferens so that sperm can't cross that divide and get into the system. So then tubal ligations, or there's all kinds of, I think, just various terminology for this, tying the tubes, removing the tubes. What this is this is a procedure for folks with ovaries, uteruses, cervixes, and vaginas. And what we do here at Planned Parenthood Great Rivers, there are many ways to do this procedure, but the procedure that I do is called a laparoscopic bilateral salpingectomy. Laparoscopic means it's done through a camera. This is surgery. Unlike, really, we talk about a vasectomy as a procedure. This is surgery. So laparoscopic means it's done through a camera. Bilateral, again, just like you got two vas deferens, people have two tubes, so both tubes need to be removed. And salpingectomy means we remove the entire fallopian tube. And fallopian tubes are where pregnancies start. So pregnancies, eggs come up through the tube, sperm comes up through the cervix, and they meet in the tube and cause a pregnancy. So like I said, we remove the entire fallopian tube. Now, this is a little bit different in that we can't do this under local anesthetic. You do have to go all the way to sleep for this procedure, and that's because you wouldn't tolerate it at all. You wouldn't be very happy with me if you were awake. So that means we have to do it at the hospital, and we operate at a hospital here in St. Louis. So that means you get general anesthesia, you go to sleep. It's a very quick procedure, about 15 to 30 minutes, though, because you're in the hospital, you do have to plan for being there for a number of hours. And similarly to vasectomy, it's very effective, greater than 99% effective. And we also offer this procedure to folks at 18 and up. Okay, and so here's just another diagram of the procedure that I do, which again is a bilateral salpingectomy. So where we're removing both tubes. So as you see, there's no changes to the cervix, no changes to the uterus, no changes to the ovary. We just remove the tubes. And that's important. And we'll talk about why, again, salpingectomy doesn't cause changes to anything else in the pelvis, doesn't change anything with your hormones, the blood supply, your periods, because all we're doing is removing the tubes. It's kind of like plumbing. We're just removing the pipes, kind of similar to the vasectomy where we're interrupting the pipe. So we can compare these two procedures. So like we said, vasectomy is an outpatient procedure. So it's done in an office. We do it in a number of our clinics here at Planned Parenthood Great Rivers. Versus a tubal ligation or salpingectomy does need to be done in a hospital. There are some places where it can be done in an outpatient surgery center, but it's still done in an operating room. A vasectomy is a quicker, overall, the procedures are both very fast, but a vasectomy is in some senses an in and out procedure. So that means you come in, get some vital signs, get your procedure, go home. A tubal ligation itself, the surgery itself is usually pretty quick, but you have to be at the hospital a couple hours ahead of time to get your IV, you talk to anesthesia, go to the operating room, and then stay for an hour or two afterwards for recovery. So it's going to be a full day for that procedure. The recovery time is significantly quicker for a vasectomy. Obviously, it's a much sort of smaller procedure. So we usually tell folks to give about 48 hours of rest, 1 to 2 days of rest. Take it easy for about a week, but you can go back to work, you can drive, you can, walk around your house, you can do really pretty much everything that you need to do. Tubal ligation, again, is surgery. So we do recommend that people generally take about 3 to 4 days to a week off of work. Certainly, when you look at what's involved in both of these procedures, the cost for a vasectomy is going to be much lower. And most of that is actually because of the anesthesia and the hospital costs. It's very expensive to go to a hospital. It's very expensive to have anesthesia, and we don't need those things for a vasectomy. So that's why when we look at overall costs, the costs are significantly lower for a vasectomy. And then the risks. So every procedure has risks, and there are certainly, if you decide to do either of these procedures, a vasectomy or a salpingectomy, we will go over the risks and benefits with you, of course, in your individual consultation. But overall, the risks of complications with a vasectomy are lower than the risks with a tubal ligation, again, because it's a surgery and the need for anesthesia. There are all kinds of benefits of sterilization, and I'm happy to talk about, more of these in detail. And again, if you come in for a consult, we would go over all of this. I think what most people really come looking for is peace of mind. So to know that they have had this procedure and they no longer have to worry about contraception or worry about contraception failure. Again, nothing in this world is perfect, but sterilizations are pretty darn close. And really, we tell you, if you have this procedure, you don't have to worry. They are highly effective, as we said, more than 99% protective against either pregnancy or causing a pregnancy. You only have to do it once. So there's nothing that you need. You don't need to take a pill every day. You don't need to change a ring every month or a patch every week. You don't have to get a shot every 3 months. So it's done. It's once and it's done. So you don't have to think about it again for the rest of your life. And again, a one-time procedure. And we'll talk a little bit about what the follow-up is, but for vasectomy, there really is no in-person follow-up. And usually for a salpingectomy, we do a post-op visit because, of course, we want to see you back after surgery, but then it's done and you're done with us and you can go on and do what you need to do. As I said, neither of these procedures affect your hormones. So really, I think about myself and these procedures as plumbing, or then I'm the plumber, right? I'm cutting the tubes in the vasectomy, and I am removing the pipes or the tubes in the salpingectomy. So in folks who get vasectomies, there's no change to your testosterone levels. There's no change to your libido. There's no change to erections. There's no change to sex drive, any of those things. And same thing for folks who get their tubes removed. There is no change to your hormones. Estrogen and progesterone are going to be the same as they were before you had the procedure. And it doesn't change your menstrual pattern. So whatever your periods were like before the procedure, they're going to be the same afterwards. Now, one thing we do like to mention is if you are using hormonal birth control, either an IUD or pills or a shot, and that is changing your menses, if you stop that birth control, your menses are going to come back to whatever they were before. So that's just a point of discussion and just something to think about. And finally, sterilization, one of the real benefits of sterilization is that it allows shared responsibility between folks that are having penis vagina sex. So it allows both people to participate and contribute to if the shared goal is preventing a pregnancy. So what are the things we like you to think about is, of course, that this is permanent. So a salpingectomy is permanent. Once the tubes are out, there's no putting the tubes back in. We don't leave ends that can be sewn back together. That was an old procedure, and we don't do that anymore because it's just not as effective. In terms of vasectomies, we really recommend that people go into them considering them permanent. Now, certainly there are folks who do vasectomy reversals out in the community. That's not a service that we provide. But there are people that do vasectomy reversals, but it is important to understand that those are much more complicated procedures. They definitely take longer than the 15 or 20 minutes that an initial vasectomy takes, and it's not guaranteed. So different doctors who do those procedures have different success rates. But what we really think is going into a vasectomy, you should consider it permanent. So for some folks, that's easy, and they know they either never wanted to have children or they don't want to have any more children. And of course, we trust you if that is where you're coming from and that is where you are in your life. We say great, and we get you scheduled for your procedure. But it is important to know that for some folks, circumstances can change over your lifetime. So you may change your relationship, or you may decide later on you do want to have a child or more children, or your health goals may shift in the future. And again, that shouldn't necessarily, that won't change my counseling with you, but it is something to consider and something to think about. Sterilizations do not protect against STIs. So if you are in a situation in which you are at risk for contracting an STI, then still we would recommend condoms for protection. The recovery time is important to think about. So you do need to schedule some time off of work. So for a vasectomy, about 48 hours. Usually we recommend 2 days unless your job is very strenuous or you're at risk of being kicked in the groin. And then tubal ligation, I recommend a little bit of a longer recovery. So 3 to 4 days or up to a week. And we can assist if people need assistance with their jobs, with work excuses or FMLA. We do that all the time. Of course, with every procedure, there are risks. The risks are pretty minimal with both of these. These are two of the most common procedures that we do. However, again, everything has risk. And when you come for a consult, depending on, what you're coming for and what we're discussing, we would discuss the individual risks for you. And for some folks, maybe based on your medical history, your anatomy, your surgical history, you may have more risks than someone else, but we would go over all of that in your consult visit. And of course, sterilization is not the only option. If you need contraception but don't want it to be permanent, maybe you're not ready for it to be permanent or don't ever want it to be permanent. Of course, here at Planned Parenthood Great Rivers, we offer all of the options for contraception. So there are long-acting contraceptions, so IUDs, implants, shot, as well as shorter things like short-acting contraception, so birth control pills, patch, ring. We have all of those options, and if that's where you are, please come in and one of our providers can talk to you about all of your choices. So first, you need to schedule a consultation to speak to one of our providers. So if you're going to end up having surgery, you're going to be seeing me because I'm the surgeon. If you're going to have a vasectomy, most of our advanced practice clinicians do consults for vasectomies. So you would see one of them, and then you would see one of the doctors that does the vasectomies. And we have a few doctors who perform the vasectomy procedure. So during that consultation, the provider would get your history, both your medical and surgical history, your medications, your allergies, just like any other medical visit, and would talk to you very specifically about the risks and benefits of the procedure that you're considering. And as I said, sometimes there are going to be some more specific risks based, again, on maybe your medical history, your surgical history, and they will go over all of those with you. And then if you and that provider decide that this is what you want to do and this is the right thing for you, we get you scheduled. Vasectomies are offered at a number of our locations, both in Illinois, in St. Louis, and in Southwest Missouri. And so we would find a date, our staff would find a date that works with you. Surgeries are scheduled a little bit less frequently because they're only when I'm at the hospital, but our nurses work with you to find a day that works for you and my schedule. And then you get your procedure. So like we said, the vasectomy is a short outpatient procedure. You're able to go home immediately. And a salpingectomy or tubal ligation, again, is an outpatient procedure, but involves a full day at the hospital. And then we talked about recovery. So just a couple of days for the vasectomy and really kind of back up to normal things. A little bit of a longer time for recovery for the salpingectomy. And then in terms of recovery and follow-up care, so for vasectomies are not effective immediately. So it is important to know that you do have to use a backup method of contraception until we have confirmed that your vasectomy was successful. And that takes about 2 to 3 months. The way that works is we mail you a kit right after your procedure. And after a couple of months, and we give you all the instructions, you ejaculate and put a sample in that mailer, send it out. It goes to a lab. We take a look at it. We get the results, and then we let you know that you're sterile and you can go forth and don't have to worry about contraception. Tubal ligations, on the other hand, salpingectomies are immediately effective. So you are sterile as soon as you leave the hospital. So we have these services at various locations across both of the states where we serve folks. So the consults can be done really at any location as well as through telehealth. In fact, most of our vasectomy consults are done through telehealth, so you can have a visit, in the convenience of your home and then get scheduled. The procedures itself, the salpingectomies are done at Barnes Jewish Hospital in St. Louis. So if you are coming from a different part of Missouri or Illinois, there may be some travel involved if you don't live quite in this area. We have people traveling from all over the state and even from other states to obtain salpingectomies with us. So we know how to coordinate that if that's what works best for you. And then for our vasectomy services, we offer them at our Fairview Heights location. We offer them at our St. Louis location in the Central West End, as well as Springfield and Rolla. And then we can certainly talk a little bit more about how payment works. So vasectomies, for both procedures, if you have private insurance, we check with your insurance to make sure that it's a procedure that is covered. You may or may not have a copay. That depends on the plan that you have in your individual insurance. And we can work with you as well for that to figure out what your benefits are and what your responsibility might be. Sometimes it's nothing. Sometimes there is a copay or you have a deductible. And so that's for folks with insurance. For folks that do not have insurance, we do have a self-pay price for vasectomy, as well as some other options to use some funding sources. We're going to talk a little bit here in a minute about one of the opportunities that we do have, which is our celebration of World Vasectomy Day. This is something that we've done every year for the past 5 years, and we actually offer 3 days of completely free vasectomies across the state of Missouri, and we can certainly talk a little bit more about that. And I think, what I'd really like to emphasize is that this is confidential care. Of course, when you come to see a physician, nobody needs to know what you're coming for. And of course, we don't share your information with anyone. But for some folks, making this sterilization is the decision to have a sterilization can be, a very private personal decision. And of course, it will remain that way. And we pride ourselves on non-judgmental care. So if you tell me that this is what you want, that this is what is best for you and your family, I trust you and we will proceed. And we're here to support whatever choice that you may make. Okay, so this is a great question. Does it hurt? Of course, everybody's concerned about that. Nobody wants to hurt. So you did hear from a lot of our happy vasectomy patients that it really is. It can be a painless procedure. Now, everybody is different. Everything is going to be different. But for the vasectomies, we use a local anesthetic. And in fact, our physicians use the no needle procedure. So we actually don't even inject the anesthetic into the scrotum with a needle. It's injected with an air pressure injector. It's really pretty cool. So most people say that part feels kind of like a hard flick with a rubber band or maybe a pinch. We do that a couple of times on both sides, and then you should be numb during the procedure. Now, of course, there is going to be touching and pressure during the procedure. We can't put you to sleep for this, but really people do great. And then for the tubal ligation or the salpingectomy, so like I said, that procedure is done under general anesthetic. So you are asleep during the procedure. Nobody feels anything. Waking up after the procedure, you have pain medicine on board. So most people are pretty comfy. The first couple of days after a salpingectomy can be uncomfortable. It's surgery. We use gas during the procedure to distend out your belly, and some of that gas can stay inside. So people often describe feeling kind of bloated or uncomfortable for the first couple of days. And you do have incisions. There are 3 incisions with a laparoscopic salpingectomy. And so all of my patients after surgery do go home with a prescription for pain medicine. And what I have found over the years of doing hundreds of these procedures, about half of people need that prescription for pain medicine, and the other half do just fine with over-the-counter medicines like Tylenol or ibuprofen. But for most people, it's not more than just the first couple of days after surgery. Oh, again, a great question. So how soon or how quickly after my sterilization can I start having sex again? So after a vasectomy, we recommend that you wait about 5 days before having sex. So before ejaculating, so either masturbating or having intercourse. And that's really because we want everything to heal up. You do know, when you ejaculate, some of those muscles contract in the scrotum, and we just don't want any risk of bleeding. Um, the important thing though to remember is even if you can, have sex 5 days after your vasectomy, you're not sterile at that time. So we encourage you to continue to empty the vas deferens, and that's part of the recovery plan. But it is important to know that you do need to use reversible contraception during that time until we figure out, that the vasectomy has worked and that you're sterile. After a salpingectomy, it's actually a little bit different. The tubes are removed immediately during the surgery. So when you leave the hospital, you're sterile, and there's no waiting time for sex after that procedure. So whenever you feel comfortable, right away is fine. If you want to wait, that's fine as well. So I think we talked a little bit about this, but it definitely bears worth repeating. So salpingectomies are not reversible. Again, the tubes are removed, taken out of the body, sent to the pathologist, they're gone. And then for the vasectomy, again, it's not reversible with us, and we really think people should consider it an irreversible procedure. However, there are folks that do perform vasectomy reversals out in the community. These are, again, longer procedures, often fairly expensive and not covered by insurance, and definitely not guaranteed. So we really do recommend that if you're going into one of these procedures, you're planning for it to be permanent. Okay, how much does a sterilization procedure cost? So can be a very individualized question because it really depends on really what your circumstances are. So with private insurance, again, sometimes the procedure is covered in totality, and sometimes folks have a responsibility for some sharing of the cost. And that's going to depend on your insurance policy. So a lot of folks have already checked before they come to see me. They know they want this done. They've already called their insurance company, and we love that. That's great to do your homework. And sometimes people don't know. And so we can help you do some of that work. If you do decide to get the procedure, we can check with your insurance company and let you know if you're going to have a responsibility. If you don't have insurance, like I said, for vasectomies, we do have a self-pay cost. It's right around $980. And that's, again, a single payment for a procedure that lasts for the rest of your lifetime. And that's the entire procedure. That includes, the procedure, the anesthetic, and the follow-up to check that you're sterile. And then we also do have some patient assistance programs, kind of depending on your income and your circumstances, that may be able to get your procedure for more of a low cost. For salpingectomies, you do need to have insurance because, again, having a procedure at the hospital is going to be out of pocket, is going to be out of reach for most folks. That would be in the thousands of dollars, and we don't have any other way to cover that procedure. So if you have insurance, please come and talk to us and we can figure out, how much is covered or if the entire procedure is covered. And then lastly, I did want to plug our World Vasectomy Day celebration, which will be taking place in October of this year at 3 locations across the state of Missouri. And we will be providing a limited number of free vasectomies. So if you're in the circumstance in which, you don't have insurance and you can't pay the self-pay, we may have an option for you as well.